The antiseptic that we're putting on the foot right now is orange, and it's making Basil's foot look like cheese puffs.
I hate people's feet. Now, somebody's nice looking feet I'm pretty good with, but when you deal with feet with like these huge calluses that smell horribly, the last thing I would ever want to be is a podiatrist. I swear it just really grosses me out. So with that being said, let's react to the show. My feet are killing me, and I think this one might kill me too.
Worse. Oh my gosh, Basil.
Oh my God, old man feet are like the worst thing ever. I've had to deal with this as a medical student, and when you take somebody's sock off and that smell just hits your nose, and you combine that with what the heck is going on with this guy's foot, oh my God, what are we doing today?
How long have you had this? Were you born with it?
I was about 28, 29 when I got that. My mother had that.
Okay, I'm not a podiatrist, but looking at him, the first thing you always want to consider, are these calluses? Are these verruca, basically tons and tons of warts? There's also something called tree man syndrome. What is going on with these feet? And you look at his son, he is just grossed out by it.
And do you have it?
No, not like that.
Okay.
That guy's like, oh, thank God I don't have this. But you know in the back of his mind, he's wondering, is this going to happen to me later because this is my dad? Is this genetic? Could be, buddy.
I'm just going to press around here, and you let me know where most of your pain is coming from. Does it hurt when I squeeze them?
Yeah.
So those are like little rocks or almost like bark on the surface of his foot. There is a syndrome called tree man syndrome, which is really, really rare. There's only been a couple hundred cases over the past 100 years or so. And it's this kind of bizarre, rare syndrome where you develop what looks like bark on different parts of your body, like on your hands and your feet. It can be related to malignancies like squamous cell cancer and typically is treated surgically, but once again, super, super rare.
Do they ever bleed?
When I shaved them.
Yeah. What do you shave
cut
them with?
Like a knife, you know?
Yeah.
Like a knife.
Okay, so what? This guy goes into his kitchen and takes out a steak knife and starts shaving this off his foot? God, I hope that he washes that knife really, really well before he puts it back. If you have anything at all like this, please don't try to cut this off yourself. See a licensed professional.
The growths on Basil's feet were very hard. It's almost like, rigid sandpaper. If you ran your hands across them, I would definitely be cutting my gloves up.
That poor guy dealing with these on his feet and that being very hard. Can you imagine if the bottom of your foot was filled with what essentially feels like tons of sharp pebbles that are attached to the bottom of your foot, and every day when you walked, you would have to walk around with them? I assume that that is how this poor guy must be feeling.
We're going to get a biopsy of this and sending it to a lab. That will determine exactly what you have, okay?
As physicians, whenever we encounter a growth on the body and we're really not sure what it is it cancerous? Is it non-cancerous? How dangerous is it? Then the first thing we have to do is to biopsy it. We take a portion of it and we send it to a pathologist to determine just what this is. Because the treatment, if let's say this is a bunch of warts, is different than the treatment if this is, let's say, tree man syndrome.
So the plan is right now we're going to soften them up with some warm water and some moisturizer.
So using some warm water, some moisturizer, the idea is to try to get them really soft so that you may be able to cut them off a bit easier than if they were dry and hard and crusty.
I feel like these growths should soften up like a warm, moist cheese.
Oh God, why did he have to bring food into this? Oh, we tend to do that a lot in medicine. And for some reason, whenever you got something that smells and is kind of funky, cheese always gets brought into it.
We're gonna go in there, we're gonna remove the growths, and we're gonna biopsy them.
So I'm glad the good doctor is actually going to surgery to whittle these off. Some doctors may be kind of tempted to do this in an office setting, but when you've got so much on both feet, it's probably better, especially in an older gentleman like this, to have it done in a hospital type of a setting where you've got anesthesia and all the help available to you.
The antiseptic that we're putting on the foot right now is orange, and it's making Basil's foot look like cheese puffs.
I will never look at cheese puffs the same way again.
All right, I'm going after this. I mean, literally cutting through this, I don't even know what I could find.
He was actually taking a relatively small scalpel blade to remove these growths. This is a size 15 scalpel blade, which gives you good control, but it's small, and it means it's going to be more work as he takes more and more of it off. There is also a size 10 scalpel blade, which it's a smaller number, but it's actually a bigger blade that may be better use in this situation. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
You know, just because these have been neglected for so long, that
why you
some
have.
areas are warts, right? Just like you or I would get a wart. And then this covers it up.
You're right.
As gross as this may appear watching this, it actually is kind of satisfying, isn't it? Just to kind of whittle those off.
This floor is going to be destroyed.
Yep.
Oh my gosh. He is actually whittling off these Cheetos cheese puffy verruca callousy stuff, and he's just dropping it on the floor. The poor janitor. I don't understand why he doesn't put something underneath to catch all of that. Like, why just let it fall on the floor?
What is it like to cut it? It looks like butter. Hard butter.
It's a lot harder than butter.
It looks like hard butter, like if you put it in the freezer.
It's like clay.
Once again, more of it all over the floor. Why not just catch this stuff? If you're a surgeon and you're watching this video, please think about your support staff. They don't want to clean that garbage up off the floor.
We need another blade.
Another blade.
It's up, my friend.
Okay.
Okay, so do you think that the camera person is lying on their back with the camera facing up and this cheesy stuff coming off this guy's foot onto their actual face? This is very satisfying as a surgeon for me to watch, but also quite disturbing.
Now, the second foot is extremely challenging on my hand and wrist. It went from butter to cheese to clay. It wasn't the easiest.
So now that some time has passed from the soaking of the foot to the second foot that they're treating, it has hardened up, making it much more difficult. It may not be a bad idea in that situation to take a 5-minute break and to put some real soaked gauze and towels and things over the foot to see if you can get it to soften up again before restarting cutting that stuff off.
That's it. I am sweaty, I'm a little exhausted, but honestly it was all worth it because Basil's feet, they look actually like feet.
Well, the good doctor did a really nice job on Basil's feet. So now I know you're wondering, what was the diagnosis here? Did he have tree man syndrome? Was this warts? Was this just huge calluses? Well, the diagnosis came back as cutaneous horns, and this is an abnormal growth of keratin in the foot. Usually cutaneous horns are just 1 or 2. This is a very weird, unusual presentation of it. And according to the good doctor, the plan is to apply urea regularly to his feet and to every month have any type of growths shaved down. So on this video, we watched a gentleman with massive growths on his feet get them whittled down. But how about a gentleman with massive growths on his nose? This guy quite possibly has the largest nose in the world, and the masses hanging from his nose could weigh upwards of 5 to maybe even 10 pounds. Take a peek at this video right up here where I react to his story from Dr. Pimple Popper and his incredible transformation. It will absolutely astound you. And if you've been enjoying my videos, please subscribe to my channel and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.